Hello, I'm very glad to be here again. We had a session this morning where I had the same presentation, and I'm going to talk about the smallest children with Prader-Willi and about behavioral challenging in the first years and how to cope with that. So this presentation, I'll talk a bit our own reaction when we have the child, the risk for the child, what we see concerning behavior during the first years in Prader-Willi, and what to be aware of, differences to expected behavior, and how to stimulate the child and respect the child's needs, teaching the child good habits from early years so life become a bit easier. So next one. With this presentation, my focus is the needs of the young child and the family. And when knowing your child with Prader-Willi, you can do a lot to help. To include the child in society, enjoy activities, and behavioral challenges can be minimized the first years. Well, my personal experience that I want to stress is information about Prader-Willi to all he met my son, and to all he meets today, it is so important. And it has always been a very big help to him and to us, parents and brother. And I will stress also to say written information with a stamp, for example, from IPWSO or from another medical authority will help, so that people don't think it's something that you intervene. Then all contacts can understand and help you and the child. So I also want to mention a great risk can be that when the parents are so shocked that the child has Prader-Willi and not the child expected, then some parents dare not be with the child. They do not want contact to the child. And some are so disappointed that the child does not react to their contact. So parents want to know what's the future. Parents search for knowledge about treatment and cure. And some parents spend more time on the internet than together with the child. A few, but it happens. And it also happens with other diseases. The child is silent, will be fed, but can, in this situation, have too little personal contact and does not then receive the important needed stimulation. So when we go to the first years, like other children, the child undergoes great development. But there are differences to what is usually seen. The newborn child is floppy, what we call hypotonic, like a child born 10 weeks too early. The child is not interested in eating, has difficulties sucking and swallowing, and tube feeding is needed. And then a very special thing about Prader-Willi, you don't hear any cries. They're not asking for attention, and it's seen and called often a silent and easy child. The first weeks and months, the child's motor and eating capacities are like what you see in a premature child, and the child's motor milestones are delayed. So after the first months, moving and motor activities develop, more strength in the legs and arms, and head control becomes better, and the child, and this is important, enjoys to be moved, physiotherapy, enjoy motor stimulation. And then gradually contact and attention become more intense. Your child responds to sounds, the child's sounds become more distinct, and the child enjoys music and singing. The child smiles to you, looks at pictures, is more visually alert. And then also eating becomes easier. Tube feeding can stop, but the child eats slowly, and there's a risk for aspiration because of the muscles in the throat and in the mouth are weaker than normal. Around age 1 year, many can sit independently, and then crawling is the next step. And I mention this because the child will follow the normal motor developing steps like other children, but just delayed. Language, more sounds, perhaps a few words, and eating is slowly easier. The child sometimes looks very interested at food, but the child does not search most often. Some fall asleep when eating, and I mention this because it's sometimes people think it's epilepsy, and it's not epilepsy. It's a very typical thing for small children that when they are sitting eating, they sometimes drop the head and fall asleep. But it's a kind of sleep disturbances. It's nothing to do with epilepsy. And then their sleeping is most often okay. Some wake up or will wake up often during night. Behavior, still not very demanding, but enjoys contact, singing, music, being danced with. Activities can be sometimes, if the child is by himself, can sit alone looking at toys, lifting up toys, babble, and can be rather repetitive with the activities. Some will react to changes in daily rhythm, but most often not at this age. Then when you go to between first and second year, motor development goes fine, crawling, standing, walking with support. And there are big differences between the children in motor abilities. And important to be aware that motor abilities in Prader-Willi do not reflect their cognition. There can be variation in both things, but they do not belong to each other, so to say. In the language, you have more words, more understanding, and play, can have favorite toys, can be persistent, sitting with the same thing. And also in the daily program, they can learn the rhythm, but can cope with changes often, or does not react to changes. And then contact, again, you see always that the children, they enjoy contact, but does often not ask for contact. They enjoy other children, or the child enjoys other children, but very often at this age cannot follow them because of their motor development is delayed. And some avoid small children because they do not know how they react and how fast they move, or they know that they move much faster than they are able to themselves. And then they prefer adults or older children. Eating is again easier. And at this age, you can see he enjoys cakes if served and will put on weight, and then attention to grandparents. I often call this age the golden age. Big progresses, still normal weight, and you have the easy smiling child. Then from 2 to 3 years, again, motor development, differences, but progress. Many start to walk, language, more words, can follow pictures in a book, understanding is better, do things when asked, play, food items can become favorite in iPad and toys, and can be repetitive. Contact to other children, can enjoy still, can participate in role plays, can have a role, but often needs guiding. Follow the others. It can be difficult to accept changes in the play sometimes. Food in the room can be distracting, and access to kitchen is best when supervised. And prefer the same routines and the age to learn all the good habits for the rest of the life. I want to stress this last line. This is the age to learn all the good habits for the rest of the life. So what can we do for the child? We can inform all contacts that the child has Prader-Willi, grandparents, siblings, neighbors, colleagues, etc. Grandparents also feel sorrow. They also expected a child without problems. So they need to know that their time for the child is a very important thing. They can play with the child, and it's not necessary to serve cakes. Siblings, tell them it's not their fault that the child has Prader-Willi, and be sure to spend time with siblings alone if possible. And friends and others, teach them how to help you if needed. They can be with the child, help you with shopping or cleaning, and they can give you an evening free for yourself. And then they are with the child. All contacts will stimulate the child's development and include the child into society. And all need to be informed about the child's diet plans. So how to plan for the child development? Food, of course, have a plan for meals that are followed. Also at visits, tell all around that the child's condition demands a plan for the meals. Especially grandparents need clear rules. Then the child will hear and learn from early on. And meals at parties, the child leaves the table, this is my recommendation, when she has eaten what is served. Because otherwise they will be sitting and looking and asking for more. And I think this is a bad care. Moving, have a plan for daily motor activities from doctor or physiotherapist that inform you. Cognition, again, talking, singing songs, reading books, show illustrations. Toys, easy to handle is good. Language, be aware of what is understood and how, and give the time for answering your questions, and only one question at a time. And then about sleep, create good habits. Again, be concrete, use drawings and signs. And a good thing is to have a whiteboard or something similar with drawings, what is planned. And then no irony, no maybes, and secure time enough for talking, answering, and keep focus. And with other children, include the child, create games where the child can participate. Hygiene, and why to mention this now? Yes, we know in older children and adults that hygiene can be a big problem, and if not, rules are incorporated from very early. Like other small children, the youngest do not understand why we have all these rules for hygiene, but you can learn the rules. Washing hands before and after a meal, after toilet visits, and so on. Teeth brushing, and fixed rules also for changing and washing clothes. And you can use illustrations and which clothes and shoes for which weather and temperature. Yeah. Okay, so I just want to thank you, and then we take a session with questions after the next presentation. And here you see my son when he was 3. He was not able to walk by himself, but he was able to move from one part and go and visit neighbors, and he crawled up the stairs when he left this small old-fashioned machine. Yeah. Okay.